Fortunately, many of us have perfect vision. It's an easy sense for us to take for granted. This video explores the wide variations in visual loss, all of which satisfy the current definition of blind. We've taken 8 activities of daily living and then adjusted the images to correspond with those experienced by our blind patients. Navigating a path, walking downstairs, counting coins, self-administering medicines, choosing a tin of beans, applying makeup or shaving, making a phone call or greeting a friend in the street are all day-to-day activities essential for independent living. It's important that all groups working with visually impaired and blind patients have a good understanding of the functional variation of the blind.
Nice to see you again.
It is very easy to imagine no perception of light, and it is important to remember that this is what the public consider blindness to mean.
An improvement of vision to perception of light may be useful to help orientate a patient within a room. It is, however, apparent that it offers little in the way of functional vision. Navigating even a familiar path is very difficult. Walking downstairs could be quite dangerous. Finding the correct change without help would require a good tactile sense and knowledge of the local currency. Independent selection of medication or tinned food is very challenging, and even simple familiar tasks such as shaving or applying makeup would be difficult. The loss of independence in these tasks is magnified by the risk of social isolation, as initiating interaction via either the telephone or facial recognition are severely impaired.
Hello, how are you? It's nice to see you again.
Once the vision improves to hand movements, there is some improvement in the overall functional ability, and in particular with respect to independent navigation. Familiar routes and paths may be recognisable within one's own home. Unfamiliar paths are likely to remain daunting. This problem is made worse in the elderly, who may already have poor motility. In comparison to perception of light, there may be clues to help with tactile sense, but overall selection of coins, medicines, or tins of food is still very difficult. Personal care and independent living would still require assistance. The ability to recognise friends is still very much impaired, and the risk of social isolation remains.
Hello, how are you? It's nice to see you again.
A visual acuity of 3/60 on a Snellen chart is the current definition of blind. There is, however, a marked improvement in functionability across all activities of daily living. Independent navigation, both within and outside the home, become possible. Familiarity with the terrain is useful, but no longer a requirement. The shape and coloration of coins becomes visible, although independent selection from a number of medications could remain hazardous. Selecting tinned food is made easier by recognition of colours and patterns. Independent living, including the selection and preparation of food, are possible. Independence can be maintained with personal care and grooming, and easier use of the telephone allows greater confidence socially, although direct recognition of friends can remain a problem without the help of voice.
Hello, how are you? It's nice to see you again.
Macular degeneration remains the most common cause of blind registration in the Western world. Demonstrating the visual loss with video is difficult. The best appreciation is achieved by forcing yourself to focus on the centre of the visual disturbance, such that the rest of the image can fall on your peripheral vision. Navigating vision is clearly virtually unimpaired, and this is of great reassurance to patients with macular degeneration. The loss of the central vision is, however, extremely frustrating and limiting. The coin you are holding becomes invisible. The medicine you have selected is lost. Selecting a familiar tin of food is possible with peripheral vision, but checking to confirm the correct ingredients is not possible. Confidence in social interaction can quickly be lost as failure to recognise even close friends becomes possible.
Hello, how are you? It's nice to see you again.
Hemianopia without macular sparing can also give a visual impairment significant enough to qualify as blind. The patients with hemianopia obviously have other difficulties associated with cerebrovascular events, and like the frustrating aspect of macular degeneration, they must learn to use the remaining peripheral field. Navigation is difficult, especially towards the direction of the lost visual field. Once again, familiar terrain aids in confidence. Demonstrating hemianopia with video requires the viewer to maintain fixation on the screen's centre, otherwise an appreciation of the problem is lost. Finding items on desks or in cupboards is very frustrating. Fortunately, social interaction and recognition are much less impaired,
Hello, how are
although
you?
friends and family may need to present
Nice to
themselves
see you again.
directly in order to be recognised.
A patient suffering with tunnel vision may in fact have a Snellen visual acuity of 6/6 or better, but as can be seen, the severe limitation of peripheral field has a marked impact on the functional ability of this type of blind. Navigation is lost, finding items very difficult, and independent movement in unfamiliar environments severely impaired. While the central visual acuity is useful and self-care and social interaction remain, this is a very frustrating variation of blind.
As we've demonstrated, there is a great variation in the functional ability of the blind. We hope this video will foster a greater empathy and appreciation of the challenges faced by patients recently diagnosed blind.
It's nice to see you again.